to the lawmakers and just grassroots work. This is a 7-year process that took place between lawmakers and insurance companies. So insurance companies, they had a lot of fight in them. And at the center of this whole bill is the language around medical necessity. What is necessary for medical care? For years before they even started working on this legislation, that language was ambiguous, and it gave the insurance companies enough leeway to do whatever they wanted. But with the help of lawmakers and frustrated family members, they were able to coerce the insurance companies into creating a list that explicitly stated what medical care was. Now, to your question about what makes this case different as it would have been in an urban center or a more liberal state, one of the lawmakers who supported the bill actually lost his daughter to an eating disorder 20 years ago. So it was more of a personal matter for some lawmakers than others. And to me, that's what pushed this law over the edge and got it the attention that it needed.
And we see that all too often. The ironic beauty of mental health issues and mental illness is that it doesn't care who you are, how much money you make, what station you have in life. It strikes everybody. As you noted in your article, one of the reasons, in addition to this legislature having it have a strike a personal chord, there was an advocacy group behind this, the National Eating Disorders Association, who pushed this, and we see that often in other types of legislation. Is there any indication that NEDA, the National Eating Disorders Association, who was instrumental in advocating for this push, and as you said, it took them a while. This was not overnight. This was several years in the process. Are they going to be looking to other states to try to get similar types of legislation?
They express some hope, but I do know that eating disorders and mental health issues in general are pretty big buzzwords now. And, you know, if anything, the time is right for all of that to happen pretty much, because President Obama touched on the need for stronger mental health care infrastructure plenty of times in the past year or so. So I think that people are looking to that, and people will start getting tougher on mental health care issues.
Sam P.K. Collins, thinkprogress.org. He is the health reporter there. Thank you so much for stopping by again, Sam, and I look forward to talking to you again.
Likewise, sir. It's always a pleasure.
And Sam Collins, a hardworking reporter covering mental health issues throughout the country. Thank you for that hard work on that, great work on that story. In addition to the years working to get legislation passed, this legislation that you just heard the report about, the advocacy group NEDA, N-E-D-A, works to provide support in addition to information and clearing up common misperceptions, fighting stigma about eating disorders. My guest is Claire Misko. She is the Director of Programs for NEDA, the National Eating Disorders Association. You are coming off a phenomenal victory in Missouri, the expansion of healthcare coverage for eating disorders, and I want to drill down into that. Before we do that, let's get some background about eating disorders, if you will. What is an eating disorder really, and what is the biggest misperception that, based on your experience, the public has about what eating disorders are?
Sure. Well, eating disorders are very complex illnesses, and in the field we call them biopsychosocial disorders, which means that there's very compelling evidence to show that there are biological roots to eating disorders, that some people might be genetically predisposed to developing an eating disorder. Obviously, there's also a lot of psychological issues related to eating disorders. Many people who struggle with these illnesses also struggle with depression, anxiety, low self-esteem, perfectionism, and there are co-occurring conditions, including addiction. And then, of course, there is the cultural, the sociocultural piece of this. Certainly the media doesn't cause eating disorders in a simplistic way, but we do live in a culture that glorifies thinness. So for those who are particularly vulnerable to developing eating disorders, this message that thinness and, the quote-unquote perfect body is the solution to all problems is really coming at us everywhere. So there are a lot of different factors to consider. They're very complex illnesses. Unfortunately, what we tend to see in the media is a very narrow picture of what eating disorders look like. The media tend to focus on, the most extreme cases. We get this picture that, if someone is dying to be thin, a very extremely underweight, usually young white woman is the picture that we have of eating disorders. And, of course, there are, people who do fit that description who struggle with eating disorders, and their experiences are valid. But most people who have eating disorders do not look like that. Eating disorders do not discriminate. They affect people of all ages, of all sizes, of all ethnicities. They affect men and women. So we don't really see an accurate picture of eating disorders in the mainstream media. So there are a lot of myths about eating disorders that we in this field are trying to combat.
One of the things, and taking off on the point that you just made about the prevalence of eating disorders across a number of different categories, racial, gender, as well as ethnicity, on your website, which is nationaleatingdisorders.org. And I urge everyone listening to check out the site. You've got a ton of phenomenal information there. One of the things that I took note of is the commonality that eating disorders, as you point out, has with mental health disorders in general. And as you said, mental health is a big part of this issue. And the quote that I want to talk to you about is from your website. The prevalence of eating disorders is similar among non-Hispanic whites, Hispanics, African Americans, and Asians in the United States, with the exception of anorexia nervosa. Is that the point that you're getting to, that it affects everybody? And it may not be the extreme thing that the media plays up a lot, but it certainly affects everybody in a number of different ways.
Yes, absolutely. And, we say here at NIDA, we say everybody knows somebody. You talk to anyone and you will find that they have someone in their lives who has been affected by these issues. And again, we tend to see this very specific picture of what eating disorders look like in most of the media stories about eating disorders, that it really isn't accurate. And we also want to, when we talk about eating disorders, we're not just talking about the restrictive eating disorders, anorexia, which is characterized by self-starvation. But, there is also bulimia, which is binging and purging. And one of another eating disorder that we are starting to hear more and more about, which affects the most people, is binge eating disorder. So again, there are lots of different types of eating disorders. And anyone can be affected by these illnesses, and so we want to make sure that we're talking about eating disorders in a way that really represents the full picture.
One of the other striking statistics that you have on your website is this: the rate of development of new cases of eating disorders has been increasing since 1950, a steady, constant rise for over 50 years.
Yes. And, we're one of the most important things that we can do, and we focus on, certainly providing resources for people who are struggling with these illnesses, and support for caregivers, for family members, for parents, for spouses, siblings whose loved ones have been affected by eating disorders. Another area that's so critical is early intervention. We want to make sure that we're screening people and getting people into treatment before their illness becomes so entrenched that where treatment becomes much more complicated and difficult. So that's one of the reasons why we want early detection. We want people to be reaching out to be able to identify the early signs so that we can get them into treatment.
Talk about some of those early signs, would you?
Well, certainly, and again, this gets back to combating the stereotypes. So we want to get away from this idea that eating disorders are just about the food and the weight. They're about much more complicated, much deeper issues, and it's not always. Eating disorders don't always result in extreme weight loss. Now, certainly, if you're seeing that and you're seeing somebody who's very preoccupied with food and weight, and where there has been a significant weight loss, that of course could be an indication of a problem. But that's not always the case. There are many people who struggle with eating disorders who are average weight or maybe even considered medically overweight. So we want to make sure that we're not just looking at the number on the scale or the size of a person's body as an indicator. What's most important is really the behavior and the attitudes. Again, if somebody is really obsessing about food, talking about feeling guilt or shame around eating, and then the other issues of really removing yourself from social situations because you're afraid of interacting around food. If you're isolating yourself, unable to communicate with friends and family about food-related issues, that could also be an indication of a serious issue. So again, really focusing on the behavior and the attitudes, and not just the physical signs. It's important when you're confronting someone to do so in a non-judgmental way. People who have eating disorders tend to feel a lot of embarrassment and shame. They tend to isolate themselves. Again, that's another one of those warning signs. If someone is withdrawing, that could be an indication in the context of these other symptoms. So really approach it from a non-judgmental standpoint. Be honest about what you've observed, the specific behavior that you've observed. But again, keep in mind that this isn't just about the weight and the food. There are deeper issues going on. People use their disordered eating behaviors as a coping mechanism, as a way of dealing with other things that are going on.
And I want to talk about some of those other things that people are dealing with that may result in an eating disorder or any other type of mental health issue. But I want to tease out a little bit further this issue about how to talk to someone and being honest. I hear that when I interview people, when they talk about addressing anyone about any sort of mental health issue. So this seems to have that in common. When you say be honest, but also not be judgmental, what is that like? I see that you're not joining us for, last several times I've asked you to come out and hang out with us. You haven't wanted to go. Are you okay? Is that the kind of thing that you're talking about?
Yeah, exactly. It's good to, because of the shame that tends to accompany these illnesses, it's good to choose a time when, you can talk one-on-one in a, quiet, private setting and give some examples, just as you noted. You could even get into, more specifics if it's something that you have, a specific incident or something that you've observed. But again, coming from a place of, listen, I'm not judging you. I care about you. I want to do what I can to help you. These are the kinds of things that you want to frame the conversation with, and then get into the examples.
Going back to the issue of things that may underlie this type of behavior, this type of conduct, is it typically a traumatic situation that happened to someone, or is that an oversimplification?
There certainly is a very strong connection between trauma and eating disorders. That's not always going to be the case, but in many cases it is. So there is that connection there. And again, as I said, there's a lot of very compelling research to show that there are some biological roots to eating disorders, that some people might have a genetic predisposition. There's a connection between depression and anxiety. So these are other areas that are connected to eating disorders.
And that takes us into the issue in the area of co-occurring disorders, that is, having more than one issue that an individual is trying to cope with. For example, depression or some other type of mental illness, along with an eating disorder. One may be the manifestation of the other. What's the best way to think about that?
Certainly, they're often someone is struggling with anxiety, and at the same time they're struggling with the eating disorder, whether that's the restriction, the self-starvation, or binging behavior. or binging and purging behavior in the case of bulimia. So these issues need to be treated, and that's why, again, when we talk about treatment for eating disorders, it really needs to be comprehensive and specialized. So, you're working with someone who has an area who specializes in treating eating disorders, and who can really understand the complexities here and be able to address the co-occurring conditions. And there are different levels of care for eating disorders. Some